So an amniocentesis is an invasive procedure performed in pregnancy whereby we take amniotic fluid, which is the fluid surrounding the baby, from 15 weeks of gestation to check the DNA or the chromosomes of the baby. The reason that you'd be offered an amniocentesis if we think there is an increased risk of a chromosomal or genetic abnormality. This may be following the 18 to 20 week scan where we find an abnormality on the scan, or if you've had one of the screening tests for Downs-Edwards-Patals and have a higher chance or a higher risk of having a baby with a chromosomal abnormality. We'll discuss the options of invasive testing, and one of the tests that we can offer is an amniocentesis from 15 weeks. The benefits of having an amniocentesis are we can check the chromosomes of the baby and tell you if the baby has a chromosomal abnormality, and hopefully for the majority of parents we can reassure you that the tests that we can perform are normal. The risks of amniocentesis and the things that parents worry about most are the possible risk of miscarriage following an invasive procedure. Historically, we used to say that the risk of miscarriage from an amniocentesis is 1%. That means 1 in 100 normal babies will miscarry following the invasive procedure. More recent data and evidence suggests that in reality the risk of miscarriage is probably lower, somewhere in the region of 1 in 2 to 300. Before we perform an amniocentesis, we would do a transabdominal scan to check the baby and to see where the placenta is. Having performed the scan, we will clean your tummy with cold, wet antiseptic solution, scan all the way along and introduce a small needle through your tummy into the water around the baby and take about 15 to 20 mils of fluid. After we've performed the amniocentesis, we will do a short scan to show you the baby's heart beating. We'll then ask you to lie down next door in our recovery room for about 10 to 15 minutes, and we'll give you information about the procedure and the symptoms to look out for when you're at home. We'd expect that you may get some mild discomfort in your tummy following the procedure, which usually lasts for 1 to 2 days. However, if you have significant pain or a gush of fluid down below, we'll give you a number to contact so we can see you as a matter of emergency. It's unusual to get these symptoms, but we would always want to hear from you if you have any problems. If the reason for your amniocentesis was because you had a high-risk result from one of your screening tests, then we will check for Downs-Edwards-Patals, and these results are usually available within 3 working days. If there are concerns that the baby may have another chromosomal abnormality, we need to grow the sample and grow the cells, and the results will be available in 2 to 3 weeks.